GRIP, a lifeline for rape victims, providing care, dignity and justice for the victims. The organization assists victims with opening criminal cases, hospital care, aftercare, support in court, and shelter, among others. They rely heavily on aid from the USA, which has been frozen for 3 months, impacting on their work.
That we've had to reduce overhead spending quite significantly. Management has obviously had to take pay cuts. We have staff that have accepted reduced stipends. We have some staff that are volunteering. And sadly, a part of all of this is that we've had to lay off quite a number of staff. So we currently have 15 staff that are not being paid for 3 months, which is heartbreaking. So yeah, the funding pause has had a bit of a knock-on effect. It's not just services that have stopped. It's a lot of job loss. So the team has really pulled together to ensure that we do have continuity of services. But I mean, the loss to GRIP is about 1.83 million over the 3 months.
The scourge of rape and gender-based violence in the country is unprecedented. Many victims depend on organizations like GRIP.
We managed to support and assist 1,940 victims of rape and sexual assault during 2024, which is a huge number of people from the communities that we service with our programs. In the 5 hospitals that are affected by the funding pause, we helped 300 rape victims in the last quarter. So that's 300 people that wouldn't have received the comprehensive GRIP circle of care that we provide. They wouldn't have received the trauma containment, the long-term psychosocial support. We assist them to complete their PEP medication, so there's some assistance to adhere to their medication. We visit them at home. It's a really comprehensive package of services.
This woman's daughter was allegedly raped by her biological father. GRIP has been with them throughout.
Mostly bandwana.
Many victims, especially young children, struggle to express themselves in court. If GRIP closed down, they won't be able to prepare the victims and survivors for court processes. Survivors will continue to commit suicide because they will see the perpetrator outside, as they will not be getting any support. And also, hospitals do give counseling, but it's not enough. GRIP give a long-term counseling to the victims and survivors. Like many organizations affected by the halting of fund, they are pinning their hopes on the Finance Minister Enoch Godongwana's budget speech for some relief.
We are really hoping that we will get some direction in terms of, is there a contingency plan in place? Will we perhaps be provided with some relief funding? We really do hope that government recognize the importance of the programs that we are running in the communities and, the amount of support that we give to the government stakeholders, to Department of Health, Department of Social Development. We are there to assist and support them as well as the community.
GRIP is now calling for donations while waiting for relief from government or US aid, or the organization will have to shut down their trauma care facilities. Dumal Machoho, SABC News, Mbombela.